is Shauna, and this is my patient Danielle. Today we're going to demonstrate how to do a chemical peel on the face. First things first, we're going to start cleansing. And today we're using SkinCeuticals Gentle Cleanser to cleanse Danielle's face. The second step is we're going to exfoliate her face a little bit, and to do that we're going to use New Peel. A little exfoliation helps the peel soak in and absorb a little bit better on her skin. Once her skin has been lightly exfoliated, we're ready to start prepping her skin for the chemical peel. To do that, we're going to use a little cloth that's been saturated in witch hazel and alcohol. Now that Danielle's skin has been prepped with the prepping solution and all excess oils have been dissolved, we're ready to start applying the peel. Now this is salicylic acid, which is what they make aspirin from. So you always check and make sure your patient doesn't have any allergies to aspirin, which Danielle does not. So we start at the forehead and just start applying in a downward motion. You also want to make sure that your patient is not pregnant or breastfeeding, because a small amount does get absorbed by the body. So it's just an extra precaution we take. Now sometimes this has a slight tingling sensation to it, so to cool that down, Danielle's holding a fan, which takes away the slight tingling feeling. Now what this is going to do for her skin, it's going to even out her skin tone to one color, reduce fine lines and wrinkles, shrink pore size, and help with breakouts. So now we've applied one layer of the chemical peel to Danielle's face. You can see she's got a whitish film, because as the peel dries, it leaves that white film on her face. That's because of the aspirin. We like to apply 2 to 3 layers to make sure that the peel gets nice and saturated. So this will be her second layer. For Danielle's third layer, we like to wait 2 to 3 minutes between each one to allow this tingle to calm down a little bit. So Danielle, how are you feeling so far?
Good. Feels like a mild sunburn and just nice and tight.
As this chemical peel dries, it dries and you get a tightness feeling to the skin, which will all, once I remove it, will be gone before she leaves today. Now we're ready to take off the peel. We're just going to use sponges saturated in water, and we're going to get off that white film. You'll notice that Danielle has a slight pink hue to the face. That's completely normal. That usually fades within a few hours after the chemical peel. We're going to check and see if she has any extractions to do on her face. This chemical peel, if she has any blackheads at all, is going to loosen up any debris that's on her skin, which makes it very easy for any blackheads, whiteheads, any congestion to be removed. area for most people to collect blackheads is right here in the corners of the nose. So we just do a few extractions there. Once the extractions are all done, we're ready for her finishing touch, which is going to be a little bit of moisturizer and some sunscreen. So we're going to apply a little bit of moisturizer to make sure that her face isn't really dry and tight when she leaves. Which if she needs to, she can apply more at home. And after that, we're going to apply a sunscreen and SPF of 30 to her face. Chemical peels make her skin a little susceptible to sunlight, so we want to make sure she's good and protected when she leaves. We'll make sure we get it in all the areas that the peel was applied. Maybe carry it down the neck just a little. And how's it feel, Danielle?
Good. I feel good. No more stinging, no more tightness. Just feels clean.
Good. So that's how we form a chemical peel on the face. If you have any questions at all, please feel free to go on our website, www.floridaskincenter.com, or feel free to give us a call at 239-561-DERM.